Your Excellencies, advocates, dear friends, I'd like to thank each and every one of you for attending this very important side event for childhood cancer at the 68th World Health Assembly. I am more than sorry that I couldn't be with you today. It would have been not just an honor to be amongst you, but also as a parent, a duty to be part of this very important session. There is no greater heartbreak a parent can face than to see his or her child suffer. Each one of us would do anything in our power to give our child the best treatment, the best care, the best chance for life. When my son Rakan was diagnosed with leukemia in 1997, he was 2 days away from his second birthday. Instead of having him blow away his birthday candles, he was lying in a hospital bed with needles and IVs hooked into his small body. As a parent, many thoughts raced across my mind, with the feeling of guilt, worry, and mostly fear. Fear that I can lose what is most precious. For the first time, my husband and I felt totally helpless that as parents, we were not able to fulfill our sacred duty, to protect our own child, and our heart broke into thousands of pieces. Our story is no different than the thousands of parents whose children are diagnosed with cancer every day. As we stand today, an estimated 200,000 children are diagnosed with cancer each year, the majority of which live in low and middle income countries, with an estimated 90,000 unnecessary deaths per year. We are still witnessing a huge inequity in delivering cancer care for our child patients across the globe. Whilst childhood cancer survival rates can reach up to 80% in high-income countries, they sink as low as 10% in some low and middle-income countries. Low and middle-income countries are still facing barriers at all levels of cancer care, starting from early detection and diagnosis to access to cancer drugs and treatment and to the availability of palliative care. There is still insufficient knowledge amongst health workers, lack of expertise, in addition to weak or non-existent referral system. And the list continues on and on. To us, in the developing world, the disparity of cancer care is not just some fancy statement, it is personified in a little Syrian child who came knocking at the door of the King Hussein Cancer Center's emergency department 3 months ago, who has a disease with a 90% chance of a cure, and who looked at us full of unspeakable pain and asked us all, "Will you treat me?" This story is multiplied over and over again, all over the developing world. Real people, real children, with no access to cancer care, neither physically nor financially. Today, we are all empowered with the knowledge that most childhood cancers can be cured if prompt and essential treatment is accessible and affordable. With this knowledge, we cannot stand here accepting this status quo to continue. We cannot accept the deadly statistics that are current. Despite being a low-middle income country, Jordan and the King Hussein Cancer Center's life-saving commitment to increasing the availability and accessibility to quality cancer control interventions to all children in the region remains unwavering. But we need more joint efforts. We need global joint efforts to continue to make treatment of childhood cancer a priority worldwide, to reduce the huge disparity amongst countries globally in the delivery of cancer care to child patients. And that is why we are here today, to advocate on behalf of children and their parents, and to send them a clear message that they are not alone. We are here today to be the voice for the voiceless millions in the developing world who to this day have no access to treatment. We have to advocate that no parent should have to watch his or her child die excruciatingly from a curable disease only because they live in the wrong part of the world. The access for a cure should not be an accident of geography. We must all decry this injustice. On behalf of parents of children with cancer worldwide, I urge you all as health ministers, political leaders, and advocates of childhood cancer to propose that a global response to childhood cancer be put in the priority agenda of the next World Health Assembly. We should not be a side event. We should be a main event. Also, I would like you all to advocate for childhood cancer to be considered in the proposed Sustainable Development Goals of the United Nations. Let us all join voices together and make noise, lots of noise, to ensure that every child has the rightful chance to live and reclaim their innocent childhood. Together, let us make childhood cancer a disease of the past for every child in the globe. Thank you very much.